Welcome. Xylazine wounds, basics for outreach.
Hi, folks. So we wanted to make a couple notes about this training, namely that the two of us are not medical professionals. We are lay people, and that this training is not for medical professionals. It's for lay people, our peers. But we certainly are informed by the wonderful work and experience and science utilized by health professionals who've spent time with us in training us. Particularly, those two folks are Lizzie Spradley and Meredith Zoltik, but there are others. And we'll name them and show you their pictures towards the end. We want to also give you a heads up that we do have photographs of wounds that we have treated. And we also want to let you know that we will have plenty of warning for those photographs. They will not just sort of pop up randomly. We'll give verbal warning and then have a few buffer seconds in case you are not able to look at those today, just not in the headspace. That's okay. And we will give warning for that. So yeah, you can either prepare yourself mentally or you can choose to look away.
Xylazine, the what, why, and where. So what is xylazine? What is it used for? So xylazine is approved for veterinary use from kittens to elephants, everything in between. It's used to treat pain and for sedation. It's a central nervous system depressant. And the onset can take 30 minutes, so it's not as fast acting as fentanyl. And it can remain quite sedating for many hours. There's a cute little picture of a kitty over there. So where can xylazine be found? 8 participating syringe service programs in Maryland, BHRC being one of them, sent around 490 samples to be analyzed by RAD, which is the Rapid Analysis of Drugs program by the Maryland Department of Health. And when those were analyzed within this time period, November 2021 through August 2022, when people intended to purchase an opioid, so heroin, oxy, fentanyl, 86% of the time they also got xylazine. Xylazine test strips exist. They're being manufactured and are also being given out in different places around the state. Things to learn more about. There are some of them that are listed here, but today what we're going to focus on is wounds.
So we're not exactly sure why xylazine is so associated with an increase in like incidence of wounds and why those wounds tend to be worse than other types of injury. Some of the research is showing that it may have something to do with vasoconstriction and extravasation, which I will define for you in just a second. So these terms aren't critical for you to understand to provide basic and like competent wound care, but for the nerds among us, we thought we would go through these because we are aspiring wound care nerds. So vasoconstriction is the term that describes when muscles, tiny muscles around the blood vessels tighten to make the space inside smaller. So think about when you ice something, you are making all of those tiny blood vessels smaller and therefore reducing inflammation, right? All of us know about icing an ankle if it is starting to swell up. Extravasation is when an irritating medication leaks out of the vein or it never made it into the vein, right? If maybe we weren't intending to hit the vein, but this is, from medical texts. And it's that irritating medication gets into the tissue surrounding veins. It's kind of like a small chemical burn, and it damages surrounding tissue. So we think, or scientists think, that xylazine may have this higher association with wounds because of these two effects that it has in the body. But more research is coming out It seems like each week we're finding out a little bit more for how it affects humans, because this is not approved, as Candy said, for human use, but it is a veterinary medication. Another thing to know about xylazine wounds is that they often show up in places beyond the site of drug use. So this is a unique feature of this medication. I'm going to explain what I mean, though. So sometimes folks who snort drugs or sniff drugs can find wounds showing up on their legs. Sometimes people who are injecting find wounds showing up in places they did not inject. In addition, they can show up at the site of the introduction of that medication to the body. So if someone is sniffing or snorting, they can show up in the, the nose and sort of mouth area, because those are so close together. If someone's booty bumping, they can show up in and around the anus. So all of those are quite common. And because it's showing up in a different place than someone might be expecting, it can be really confusing. So it's a good thing to start talking with folks about the possibility of wounds and making sure to, keep tabs on wounds, even if they're not showing up where they're expected. So typical progression can be hard to define because we're learning a lot and we're collecting information as we go. And I mean, we in the sort of bigger sense of we in North America and we across the world when it comes to xylazine use. There's still a lot being developed in terms of our understanding. But often we've noticed that wounds associated with the xylazine often show up as sort of like smaller blisters, or there's a bumpy patch on someone's skin, or even called bug bites. And that's largely what people who I've talked with who have these wounds have called them. They're like, I think there's bed bugs, or there are bed bugs and mosquito bites, or, these various things that are associated with like itchy, raised areas of the skin. They can also be painful in addition to itchy. It tends to worsen from there. And that period of like sort of itchy, painful, bumpy, blister kind of experience can quickly turn. And what I mean by quickly is like 24 hours, 48 hours, or a week. It can really depend. And that area of itchiness, that area of blister can start to open up. And it often looks like an area of missing skin. There can be pus, inflammation, discoloration. And then it can even look like eschar, which is there's a diagram to the right here, which looks sort of like a plug of darker colored, dead, hardened skin in the surface of the skin. So it sort of looks like a hole that's filled in. It can be hard to determine what it is if you're not used to seeing it, but if you do see it, at least you'll have some familiarity with what it can look like and why it can be developing. And it often develops because of xylazine, but that's not the only reason why it might develop. So these conditions can worsen quickly. And the hardened skin can be deceiving because you might think it ends at a certain point in terms of depth, but it can go much deeper than maybe you can see and that you might even imagine. So at this point, we're definitely concerned for someone, and we can also sort of prep them for these things might come along if you're seeing them in the sort of bug bite stage.
So the next two slides have wound photos on them. 2 wound photos per slide. So I'm going to give you a moment to prepare yourself or look away if you need to. Okay, so xylazine related skin conditions. So on the left, we can see an area of missing skin that has started to scab over, evidence of pus and drainage, possible eschar. And then on the right, we have an area of missing skin starting to heal back over. And then in these two, on the left, we have a blister forming, and there's a progression of eschar happening. And then on the right-hand side, we have areas of missing skin, evidence of pus drainage around the outside, and then a patch, like a large patch of eschar. So the question now is, now what? These wounds can and do improve with basic and consistent wound care. Prevention! So good news. These are things you already know, right? So don't wait until they happen to talk about wounds. Don't wait. Talk about xylazine related wounds to address potential and anxiety and confusion. Make sure that you share that xylazine related wounds can progress rapidly. And talk about and remind folks of best injection practices, safer snorting techniques, and safer booty bumping protocol.
So you've had all those conversations with folks, despite the fact that xylazine can make wounds crop up, even if you're using your best techniques, those techniques are still really, really critical. And you've prepared folks to talk about wounds, and yeah, you can do this. Good news 2.0. So here are the 4 things that you can do that we do regularly. One is to give wound care supplies in copious amounts, large enough amounts that people feel really like they don't need to ration. You can clean and wrap wounds for folks, or you can give instructions for how to do it. You can help to track progression. And when I mean progression here, it's either worsening, you can track it's getting worse, or you can track it getting better, or both, right? It can do all sorts of things before it is resolved. And the 4th thing you can do is refer to higher levels of care and follow up with people. We're going to talk about each one of these, and then we'll talk through a scenario. So the first thing that you can do is give wound care supplies in copious amounts. What supplies? Well, some of the supplies that we give out and that are most popular and easy to use are ointment, A&D ointment or Vaseline, very straightforward to use, and it can be used for lots of other things. You can put it on your lips if they're chapped, and we don't recommend doing that for antibiotic ointment. So A&D ointment can be used all over the body in endless amounts. And so we give that out in small packets and in tubes. Individually wrapped gauze pads, just critical for so many things. And we'll share a little bit more about how we use them, but always have plenty of those on hand in usually 2 or 3 sizes. Cohesive bandages, they're often called co-ban for short. And we have a little picture of those on the next slide, but it's sort of a self-sticky gauze wrap that can help hold on those gauze pads and things like that and offer some protection. Saline water ampules or just water. Lizzie, who has taught us a lot, says just clean drinking water is also fine, but a little bit of salt in that water is fine. And BZK wipes, something that a lot of syringe service programs have on hand. Those are great in terms of not drying things out too much, like alcohol pads, not restricting clotting like alcohol can do, and really substitutes for soap and water when folks don't have access to it. And then some kind of information handout is always a good thing to make sure to have. We always ask people, are you familiar with these supplies? Do you like this? Is there something you like more? Often I'll ask people, like, how do you take care of your wounds, or what wounds are you hoping to use these supplies for? Are there supplies that we don't have that you would like, or that you found really useful? And just asking folks questions about how they take care of their wounds and things like that can open up areas for your learning, and it can open up areas for you to offer things that you know to them. We usually hand these things out and put them in either Ziploc bags or even in a paper bag inside a larger plastic bag that contains all of their supplies. It's really helpful for folks who are experiencing homelessness or who are outdoors a lot, just to have something that won't get wet, but you all already know that. Cleaning and wrapping the wounds. You can do this too. This does not take too much, medical know-how, as long as we're following some basic steps. Here are some of the supplies that I use and that Lizzie uses, and other folks, Meredith, who we mentioned earlier, also use. So these are not to scale. The first thing that you should do is hand sanitize and put on medical gloves. Then you'll get out your supplies. We use puppy pads. They're also called like procedure underpads or medical mats or chucks, right? And that's just to put underneath the area that you are going to be cleaning their wound. Wound wash, saline, or again, Lizzie always says just water is fine. We use a like spray wound wash. It's saline in a squirt bottle called wound wash. Get out some gauze pads. You can do the individually packaged, or in this case, since we know that they are clean, because they're in your supplies and they're, protected in a Ziploc bag, take out just sort of a stack of individual gauze pads, like you'll see here in the slide. And obviously, something for someone to sit on, prop their arm, leg, foot, whatever on, and then always having some trash bags on you so that you can easily clear those things up. So you have to expose the area, and then, so you're taking off any soiled wrap or wound items that might have been put there. Sometimes people have like really well wrapped wounds that they're very dirty on the outside because, they are outside. And so the outside of their, gauze wrap or whatever it may be has just been soiled by the time they come to us. And so we're just taking those things off and trashing anything that is, unwanted or been soiled. So gauze pads that are, have dirt on them, that have various other things, gauze pads that have too much drainage in them at this point, just removing all of those layers, putting them right on that procedure pad for you to kind of fold up and toss a little bit later. So removing all those layers to get a visual of the wound. Sometimes folks have done a lot of DIY wound care, and so we see toilet paper, we see socks, sometimes scarves, things like that, wrapped around wounds. If there's at any point, whether it's a sock, toilet paper, or gauze from a hospital, we're going to pull very gently to expose the wound, and we're going to ask the person to let us know if they feel any tugging or pain, because oftentimes the dressing will get dried onto the wound, and we don't want to pull off scabs, and we don't want to cause pain. If something is stuck to the wound, we can spray it with a lot of water, saline, or wound wash, wait a few moments for it to loosen up, and then we can pull it off from there. Go slow. And yeah, definitely be in conversation the whole time. This is sometimes where I will ask, while I'm just busying myself doing some of these things, I'll ask, when did it show up? How painful is it? Just kind of gathering information and building more of a relationship about the wound with the client. Once you rinse it off fully, you're gonna, again, just like, do not hold back, pour as much water as you can. If it's a recent wound and there's a concern that there might be some kind of debris inside the wound, this is something I learned from the wilderness first aid, is try to use water that's under some pressure so you can kind of clear out any debris in the wound. So there's often a suggestion to fill a water bottle and poke a hole through the top so that you can kind of stream the water into the wound. For the wounds that I tend to see, they are not new. They're quite old and they're quite painful. And so I do as much sort of, as hard of a stream as the person can handle. And I don't bother like trying to, get them to toughen up or like, experience anything that is just like not okay, not comfortable. And our wound care dispenser has like a little nozzle, so you can adjust the spray. And you can also adjust the spray by just moving the bottle back away from the wound as well, right? Closer up is a harder spray, farther away, less of a hard spray. So just keep it going with that wash, and use your gauze stack to wipe away any debris, car fluids and things like that. I was gonna say car ointment. Anyways, fluids from cars where people are staying, things like that. So definitely just wipe as you go around the wound. And then maybe if there's some like fibers or anything like that coming from the wound itself, like, stuck in there, you could try to just gently wipe in the wound. But again, being really careful and really checking in with the person that you're assisting. And then we want to put on a really good layer of ointment. In the photos here is also something called Zero Form, which is it's a thing in that's yellow in that package. And it's basically Vaseline that's already in a large gauze pad. So it's like already in there. And so that can be utilized as well. Sometimes people use honey patches. Meredith Zoltik says that she tends to not use honey patches for folks who are living outdoors, because sometimes the smell of honey can also attract insects. So check in with the person, see what they like. Honestly, you don't need Zero Form or honey patches, just some good Vaseline, some A&D ointment right on that wound, then clean gauze over top of that, cushioning it as much as the person would like. And then using that Coban here, you'll see it's yellow, using that Coban to wrap around, covering all that gauze, however best you can. I've done folks' fingers and hands, and that can get awkward, trying to figure out a way to make sure that gauze stays. Do your best, and certainly continue to ask questions of the person you're assisting to make sure that it's not too tight, that it's comfortable, that they can do what they need to do for the rest of the day with what you're wrapping. So I went over these just verbally, but this is a reminder of putting on gloves. Also, we include here masks, right? You're going to be close to someone, so being careful of COVID. And if there's any chance that anything could splash up on you, use eye protection as well. I want to go over getting consent now. So consent is an important thing for all things, yeah? And getting consent is additionally like very critical here, because we need to say, I'm not a licensed healthcare professional or practitioner. I am trained, I've read up on this. Would you like me to look at it? Again, not a healthcare professional, but I can offer some thoughts based on my experience and my training. That's the kind of thing I say, and I wait until they say, okay, sure. Sometimes people are like, no, I'd rather wait till I can see the doctor, or wait till I can go to my, primary or whatever. That's fine. But always making sure they know your level of expertise and that you don't oversell it. And yeah, that often, that also builds trust, right? People aren't thinking you can offer something you can't. And people are like, oh, okay, well, thanks for telling me that. I can't wrap my own hand because it's too awkward. Can you help me? Sure, absolutely. So definitely making sure to say that. And I often will say that several times throughout the experience of me cleaning and wrapping wounds. Is like, oh yeah, remember, I'm not a healthcare professional, but here's what I think might be going on. Who do you trust? Other clinic that you like? I sort of talk through what could happen if they wanted to see a professional. Where would they even think about going? Have they had good experiences anywhere? What should they be looking for? Even like if it gets way worse, where would you go? sort of do that problem solving while you talk, and repeat sort of your level of expertise so that they don't get the sense that they've had it looked at by a nurse practitioner when they haven't. And then I always give plenty of supplies to the person before they leave, and make sure to repeat any kind of like educational points that we've said or that we've talked about during the time while I've been wrapping their wounds. If you remember nothing else about how to do all of this, keeping wounds clean, keeping them moist, so with that ointment, right, and keeping them covered. Like that's a good way to go for wound care. The third practical skill that you can offer without any specialized degrees is that you can help track progress. And again, we mean progress as in worsening, and we mean progress as in getting better, signs of healing. And often those can be a mixture. So I will often note the size of wounds and any kind of other things that I notice, like discoloration, or the person reports a lot of pain or not much pain at all, just in our regular notes, just like how we keep track of all the things we do services related. I'll keep that in our notes so that when we see them again, we can sort of build on any changes that have happened since the notes were last taken. You can also take photographs. That's why we have these photographs to share, is because these are folks who said yes to being photographed to help track progress. And they also said, yes, you can use this for trainings and other educational purposes. You can also outline a wound with a permanent marker. We have permanent markers as part of our wound care kit, so that we can talk to folks about, hey, if this starts to expand beyond these lines, then it's getting bigger. If it starts to shrink inside the line, it's getting smaller. It can be really hard to say, like, it was a quarter size and now it's slightly less than the size of a quarter. Those things are hard to keep track of over time. Make sure that, again, if you're taking photographs, that you get consent and you go over any potential for that photograph, to get out into the world if they don't want it to. These are certainly times when you really need to be thinking about how we're going to problem solve, getting them to expert assistance. So if the wound is getting worse or is not improving within 2 weeks, it's best to have them seek medical professional treatment. If there's an odor to the wound or a streak coming from the wound, so sometimes this looks like someone has scratched above or below the wound. Usually it's going to be towards the heart from the wound, and that could be a sign of a really serious condition. If the area feels warm or even hot to the touch, I've done this where I've just said, can I touch, the area right nearby? And I've done that without gloves, but after hand sanitizing, so that the glove doesn't change the temperature, so I don't have trouble feeling it. And if it's hot to the touch or quite warm, that's a sign of a serious infection, or it could be. Some of the other signs of infection are an increased, right? Increased discoloration, increased pain, or the presence of fever or chill. So these are all things that are red flags, and that you would want to problem solve, getting that person to expert care as soon as possible.
Harriet, I would love to hear what your approach would be to this scenario that I'm going to read to you. So a new client comes up to our table on the street, and Jared notices that when he hands the bag over to the client, he only uses one hand because the other is tucked into his jacket. Jared asks if his hand and arm are okay, and the client responds that he has an injury. Jared lets the client know that we have wound care supplies, and Harriet can look at it if he wants to. He would love some supplies and says maybe someone could look at it.
Yeah. So how we typically do this when we're at services is we try to be observant and nosy. So like this is a true experience that we had when Jared and I were out, and Jared is in this photograph to the left. And yeah, he was like, hey, is your arm okay? Is your hand okay? So the client came over to me for wound care supplies, And I just said, like, what do you think is, as I was packing up supplies, asking, do you want this? Do you want that? Just asked a few questions like, what do you think is going on? Or how did it get hurt? And as I was packing things up, he said, like, yeah, actually, can you look at it? Because my mother wrapped it, but we didn't have any gauze. We just used toilet paper. And I was like, okay, yeah, let's look at it. And so I was like, hey, just to let you know, like, I'm not a medical professional. I've done some reading on this. I have some experience doing like basic first aid, but I'm happy to help if you would like. I'll just sort of tell you what I do know. And yeah, happy to, have extra hands if you would like it. And he was like, oh yeah, sure, no problem. Like, my mom used to be a CNA, she knows some stuff too. And we just like chit chatted about that for a little bit. So I always make sure to, again, say my level of expertise and lack thereof. And so what we ended up doing was I asked him if he would want to take a moment off to the side and have me wash it off with saline. And he said yes. And so I sprayed the saline on top of the toilet paper because it had stuck into the wound. And then we pulled out pieces. This is after, of course, I hand sanitized and then put on gloves. And yeah, once we got most of the toilet paper out, using a lot of saline to wash it out and to loosen it, we looked at it and I said, like, this seems, you must be nervous about it. And he said, yes, this is concerning to me. And I was like, yeah, it seems like it is. And we made some plans, like, where do you tend to go for your medical care? We made some plans around that for him to go the next day and what he would need to do in order to get there. And it's a clinic I'm familiar with. So I was like, oh, I think it's really good to get there at 8 a.m. because you know how the line is. And he was like, absolutely. So we chatted about that. Once I removed all of that toilet paper and had it really well rinsed, we put some A&D ointment on and then just put plain gauze. I talked with him about honey patches and he was interested. And so I threw some of those in for him to take later because he wanted to think about it a little bit more. So put some of those in his bag. And then, yeah, just carefully wrapped it up and wrapped it in such a way that he could still move his wrist because the wound was higher up than his wrist. We talked about Xylazine and how confusing it can be. And we talked about importance of keeping it clean and all of that. Yeah, so it went really well. He's since come back and gotten more supplies, and he did end up not the next day as originally planned, but the next week he did go to his clinic for assistance. So it doesn't have to be like a huge deal. We tend to just have conversations as we're packing things up and go at the pace of the client. But this is not news, I'm sure, to any of you who do harm reduction services and outreach all the time. Just wanted to share this scenario so that it doesn't seem like an intimidating additional thing. It's probably something you could work in quite easily to the work you already do. This brings us to the issue of confidence, something that Candy and I talked a lot about, is that it can be intimidating. It can be nerve-wracking. If somebody wants to show you a wound, or if you ask like, hey, is it okay if I see it? Sometimes we're not sure how we should react, or, what are they expecting from us? So I often just say like, hey, I don't know a whole lot. You can show me, but I may not know what to do. Or like, hey, you can show me, we can try to think about it together. I would love for you to like share some of your experiences with wounds and that kind of thing. But it is, I feel this lack of confidence often. And for me, the most helpful thing is to name sort of what I can offer and what I can't offer. And that helps me get over the nerves I have around trying to assist someone in an area of expertise that I've sort of built over the years, but certainly didn't start out with any confidence in this area. And I still don't have a lot of confidence in the area, right? I'm not a wound care nurse, or I'm not, this is not my day-to-day bread and butter job. So yeah, I think some of the other things to look out for, if you remember, are to ask about HIV care, HIV testing, right? Because anything that can compromise the immune system can also make wound care a little bit more complicated. And I always ask about diabetes, especially if there's any foot wounds. So, again, your basic problem solving around getting to any other resources is what you can rely on as part of your confidence here. The very least, you can wash something and put ointment on it and wrap it up. And at the very least, you can give a lot of supplies and problem solve how to get somebody more assistance in the future. Hopefully in the near future, that they have a place they trust and they can go in the next several days if they're interested. And certainly if they have any of those red flags related to wounds, we're thinking, how can you go today?
Wounds do heal. They heal with consistent, high quality care. Even pretty persistent wounds can get better. The next photo has 2 wound photos on it. I'll give you a second. So these are 2 pictures of the same hands, right? Client on the left-hand side, the client reported that this wound started out with like bug bites. And then the slide on the left names that after several months of the client diligently keeping up with the wound care on and off for a few months, and he had reduced the use of his drug of choice, his hand had recovered to this point.
And the next slide has one last photo, and we're really excited to share that it's not a wound photo. It's a healed hand photo. So yeah, after quite a while of this client's home care and coming to see me and showing me progress and me cleaning it up and things like that, as well as being on buprenorphine, his hand is really quite healed. It took a long time, took maybe more like 9 months. But he did do it, and he did do it even with a pretty significant TBI and memory issues that stem from that. Did a lot of reminding, trained up his brother, and yeah, just did our best to be patient. He did his best to be patient with himself, and this is where he was able to get to.
So, closing and feedback. We are really grateful that you joined us today for this training on Xylazine wounds and for basic outreach care. We would love for you to fill out this survey, bemorehrc.org/feedback23. Whenever y'all give us feedback, it gives us the opportunity to learn and grow. And also just connect with us in any way you would like, right? So Harriet's email is at the address. Harriet's email address is at the top, just like admins. We have a phone line for text and voicemail, and Be More HRC is on IG, Facebook, and Twitter.
And last but not least, we want to thank these 2 wonderful healthcare professionals again, and then of course give references for the information that we gave today. Lizzie and Meredith have been so generous to us in terms of their time and sharing their expertise. And I want to especially thank our clients in addition. They have built trust over the course of years at this point, and been so gracious with extending that trust to me in this new area of interest and of practice for me. And they've shared a lot of wisdom throughout the last year, 2 years at this point. So yeah, really want to thank all of those folks, as well as these 2 healthcare practitioners. Thanks so much, everyone.